And we'll start in about 1 minute. Make sure that we get a sufficient number of you joined. But good morning. Let's make sure that everything is working. And as Katie has said in the chat, welcome to Coffee Chats with Economic Alliance Snohomish County. And we will get started now. So those of you who are on this call with us, please raise your coffee cups or drinks to the sky in solidarity with us. My name is Gary Clark, President and CEO of Economic Alliance Snohomish County, and I am honored to bring this Coffee Chats opportunity with you all today. And with that in mind, we're gonna do some housekeeping as we always do. So please add your organization to your name on the chat feed so that we know who you are and who you're with as you engage us. And then additionally, if we could please have you all actually engage. This is going to be a very deep conversation about very poignant and important focus of our community in Snohomish County and the region. So we'd love for you to chime in with questions, comments to our panelists here. With that in mind, I'd love to just cue this up a little bit and by saying that our conversation is going to be focused on homelessness. And with that in mind, I really want to just briefly highlight just a snippet of my own personal story. Those of you who may have heard of my story. I've come from Washington, D.C. originally, where I was in and out of public housing and homeless places all over Washington, D.C. and the Maryland area. Both my parents were drug addicts at the time, and I was probably in chronic homelessness from maybe age 5 to my senior year in college. So this is just to kind of cue up this conversation. I've had family members who have lived and died in that space. And so this is a topic that's near and dear to me. There is no immunity to the trials and tribulations of life. And I think we all know that any walk of life can be impacted by this space. And so I hope that you all open up your minds and your thoughts to have a great conversation about this. With that said, I want to introduce our lovely, awesome panelists that we have today. First and foremost, we have Stacy Alice. Stacy comes to us from Compass Health. She's been with Compass Health for over 20 years. She started her career as a clinician working with older adults, and eventually transitioned into management, first in the quality department, and now as a chief operating officer. Stacy, we really are excited to have you here with us today. Thank you for taking the time. Additionally, we have Dwayne Leonard. Dwayne is the Executive Director of Housing Authority, Snohomish County. He has been with Housing Authority for 26 years and grew up right here in South Snohomish County. Dwayne, we love having you back, and I really appreciate your involvement here today. So thank you. And I love the tie. I was going to say bow tie, not quite a bow tie. And last but not least, and this is someone who I get to kick it to after this introduction, is the awesome Holly Shilton. And Holly comes to us as the supervisor of direct services for Snohomish County's Office of Housing and Community, as well as the program supervisor for coordinated entry in Snohomish County, the Housing and Essential Needs, HEN or HEN. So folks, Holly focuses on rental assistance program and one of the local co-leads for SOAR. So you all know this probably as the outreach, access, and recovery piece. Without further ado, Holly, please give us some insight from your perspective to cue this up. Thank you.
Thanks, Gary, and thank you all for having me and us. This is definitely a topic that's super pertinent for us as a community right now. So just some of the numbers that I have for you come from our most recent full point in time count. I'm not sure how many of you know about a point in time count or the PIT count. I sincerely apologize. The dog is barking at somebody at the front door, so I'm going to try
Totally
get her
fine.
to calm down.
Totally fine. All of you know that we have dogs all over the place. Dog friendly Zoom.
Oh man, sorry about that. So our point in time count, or our PIT count, is conducted once a year, usually towards the middle or end of January of every year, and it looks at who in our community is experiencing homelessness and what does that experience look like. So we do a sheltered and an unsheltered count. The sheltered count, we really do look at all of our local shelters. We don't really have transitional housing in our community as like the true definition, but any kind of transitional programs, we look at those as sheltered. And then the unsheltered count, we're looking for anybody else, somebody who is living on the street, who is living in a place not meant for human habitation. And so we go out into the community, we canvass, and we look for people who are experiencing homelessness, and we ask them a whole stream of questions around, are you experiencing, is this your first experience? How long have you been homeless? Where were you last stably housed? Where did you sleep last night? We also ask about, are you somebody who is experiencing a substance use disorder or any kind of mental health concern? We used to ask what contributed to people's homelessness, but it's such a wide question, and it could be so many different things that we've kind of taken that piece out. So we used to have good data on that, but it was also like we had the data, but we weren't sure if it was truly accurate. We also ask for people's demographics. So we do ask race, ethnicity, sexual orientation, gender identity, and we do ask as well about HIV and AIDS status, because that's another thing that we track in our system. So this last year, 2020, was fabulous and wonderful and different, right? So we did not get a chance to do an unsheltered PIT count. We did do a sheltered count. So we used our shelters to count how many people were experiencing homelessness that way. So I'm going to give you some information more about our 2019 count, because that's more full. So that happened in January 22nd of 2019. And at that time, we had 599 people who reported experiencing homelessness. And that's that combined count. So that's sheltered and unsheltered. We had 495 families. So some of those people were part of a family unit together. The vast majority of them were between 31 and 61. So we break it down by age bracket, and we had 21%, which was 31 to 40, 23%, 41 to 50, and 20%, which was 51 to 61. And so the other thing that I've heard from talking to Katie is that a lot of people on this call may be somewhere up and down the I-5 corridor. So I'm just going to give you some information about the cities that sort of are around that. So Everett, there was a count of 243 people experiencing homelessness in 2019. Marysville, the count was 78. Linwood was 45. And then Edmonds was 14. So we do see numbers fluctuate all over the place. We also recognize that this count is not 100%. There are people experiencing homelessness in a way that, in a way that we would call like hidden homelessness. So we use the HUD definition of homelessness. So that does not take into account people who are doubled up or couch surfing. And if somebody came into our office and they said, I am couch surfing, I would never tell them that they are not experiencing homelessness, that you do not have a home, you are not housed, right? But as far as our systems go, we go by our housing and urban development definition, which is, again, those who are literally homeless. So this number doesn't encompass that group of people. It also only encompasses, when we're talking about the unsheltered count, people that we could talk to. And people who would give us permission to talk to them, right? So we certainly, having been part of the count before, I have encountered people who say, you know what, I'm not interested in talking to you today. That's fine. That's their choice. So we wouldn't have counted that person because we wouldn't have gotten a full set of data on them. So it's not a full count. Just want to put that part out there. We do know that there are other people in our community who are experiencing homelessness, and we haven't captured them. Our coordinated entry system.
Hey, Holly, just keep flowing. We don't mind the dog bark at all.
Okay,
Yeah,
sorry.
no worries.
Okay, so our coordinated entry system, which is the system that people access to get to get referred to housing opportunities in Snohomish County. It's community-based, but it is national. Like, we have every community continuum of care in the country uses coordinated entry. So it's not just Snohomish County, but in our system for Snohomish County, we have a total of just over 1,000 families. And when I say families, that's heads of households. So it could be a family of an individual, right? It's not the typical family with children, but there are families with children in that number. And that is accurate as of, I believe, yesterday. So we do see a lot of people who are really struggling and really needing that assistance. And then as far as, I think that's about all of we do see a highlight of serving veterans, making sure that we have veterans, as few veterans experiencing homelessness as possible. We also specialize services for those who are fleeing domestic violence or intimate partner violence, as well as youth and young adults. So young adults is anybody 18 to 24. So we have specialty services in our community for those groups as well.
Okay. All right. Well, thanks, Holly. And can we get the name of your dog? Just so
yes. Her name is Piper. She's just almost 1, and she's usually so good, but somebody walked by the front door. I've got the front door open, and she's just telling me all about it. Sorry.
Totally fine. What kind of dog is she?
She's a golden retriever.
Golden retriever. Nice. Well, with that queued up from Holly, folks, I think it'd be great for us to just dive into some more direct conversation. But let's further cue that up by allowing Stacy and Dwayne just to give a brief intro of their thoughts and who they are. So Stacy, if you take the lead, and Dwayne, you follow up, that'd be great.
Sure. So thanks, you guys, for inviting me today. So Compass Health, we're a community behavioral health provider, and we see firsthand, and I'm sure it's not news to any of you, that there's this really significant intersection between homelessness and mental health, substance use, and other socioeconomic factors that all kind of play together. I did a little research ahead of time because I like to feel prepared, right? So the Substance Abuse and Mental Health Services Administration, SAMHSA, estimates that 30% of people who are chronically homeless have mental health conditions, and potentially 50% have co-occurring substance use disorders. So it's, those are significant numbers relative to the general population. And there's a sort of two-way dynamic with behavioral health and homelessness. So, for example, my behavioral health condition might contribute to the factors that lead to my homelessness. So maybe I'm depressed and experiencing a lot of absenteeism at work, which could impact my employment, which then impacts my economic stability, which then can impact my housing. Or I may have some, behavioral disturbance as a result of my disorder that's putting my housing at risk. But also, if we flip that on its head, there are many other reasons that people become homeless But being homeless can absolutely have an impact on your mental health condition, right? Depression, anxiety, trauma are incredibly common results of experiencing homelessness. And being homeless makes any of those conditions additionally challenging to treat, right? It's especially hard to take care of any of your health concerns when you are experiencing homelessness. And so trying to help folks, experience improvement on their behavioral health conditions while also, they are experiencing homelessness is just a huge challenge, and it makes everything that much more difficult. So, I guess I just want to acknowledge that there's many factors that can contribute to homelessness, but that intersection, that interplay between experiencing homelessness and experiencing a mental health condition is a critical piece of the puzzle that if we can treat proactively and preventatively to try to address concerns that lead to homelessness, that's important. And also making sure that individuals, as they're experiencing homelessness, aren't somehow cut off from access to treatment. Both of those things are really important.
Thank you, Stacy. Dwayne?
Yeah, I would just second what Stacy has said and Holly has said. I mean, if this pandemic has taught us anything, it's about the importance of mental health care, and that it affects every single person in every single socioeconomic class. I mean, that's how important it is. And it affects people in poverty even more. My organization is in the process of becoming a trauma-informed care agency, and we're learning a lot about the ACEs study, the adverse childhood experience, study, and how poverty itself is an adverse childhood experience that can develop mental illness from, because your mind is so focused all the time on just your day-to-day existence. I mean, the saying is being poor requires a lot of mental effort, and that reduces your bandwidth. And a lot of people think, mental illness is you're mentally ill and then you lose your housing. And that is true for some people, but often the case is you become homeless because you can't afford to live someplace, and then you develop mental illness once you're on the street. So, and that's the very important thing to understand. I think severe mental illness in the general population affects about 5% of the people at various different times in their life. But if you're homeless, it affects over 20% of the population. So it's 4 times more likely to have severe mental illness if you're homeless. And that affects all of us in our community, because because we have to deal with these people on a daily basis. And I'm very interested from my organization, because frankly, our programs don't really address homelessness very well. You have to be on a wait list to get our programs, and we're dealing with people that have been on the wait list since 2013. But on our programs, there's a significant amount of people that have disabilities, and a lot of those disabilities are mental illness. Almost 60% of the people on our Section 8 program, for example, have determined to be a disabling factor. So, and of course, we can't ask those questions about what it is, but that's significant. And so it affects our staff, who are not necessarily trained to deal with disabilities or with mental illness. We're trained to house people, not necessarily deal with their other conditions. And so that's why I'm very curious about this subject and how much work needs to be done in this area.
Well, thank you all. I think this is an opportunity for us to start to dive into some Q&A. And I think Holly, will start with you as a follow-up, and then Stacy, you can follow up after that, and then Dwayne after this first question. And I want to cue this up by quoting someone who is obviously, for me, has been a quintessential writer for America in times of struggle and poverty. As James Baldwin once said, anyone who has ever struggled with poverty knows how extremely expensive it is to be poor. And I think for me, it always shines a light on how we can realize that we aren't that different as citizens. No matter what our status is, we're only a few issues or health concerns removed from having those struggles of poverty. And so I'd love to hear your thoughts as a panel on what solutions or models we have in place to deal with and support our homeless population. So Holly, we'll start with you.
Yeah, thank you. So as I mentioned earlier, we do have a coordinated entry system. So that is accessed for folks through 211. We do have, so that can be a phone call, but we also do have some walk-in locations. And that, as Dwayne mentioned, a lot of our opportunities previous to the coordinated entry system had wait lists. And so people had to go from place to place to place and put their name on a wait list and keep up with that wait list. And if, you know, if a wait list was full, they could be looking at years, right? And so coordinated entry was put into place to take care of keeping people from having to do that. Now, not every location uses coordinated entry. Hasco, for example, they have some programs where they're filling through coordinated entry and some where they don't. Same with our Everett Housing Authority. But what we find is that not only is somebody coming, a family or an individual coming in to seek homeless housing services, but they're also looking for a connection to all of the other resources in their community. So we have a lot of people who are underemployed or who may have had good work in the past, but because of their experience of homelessness, they've lost connection with their previous employers, or they don't have a place where they can safely sleep the night before a job interview or can get cleaned up before a job interview. They don't have a place to put their things when they go to their work, right? If you are living on the street, for example, it's not safe for you to just go ahead and like stick your backpack over here and come back in 3 hours. It's not going to be there anymore. And so there's a lot of stigma, obviously, attached to people who are bringing their full belongings into the first opportunity that they're going to meet their employer. And so that's a big concern for folks. One thing that we can do through coordinated entry is connect people to employment services. We do have multiple providers that we coordinate with that will walk people through wherever they're at, starting wherever they're at, through to securing employment. So that could be starting off with, I just need somebody to help me look at my resume. But it also could be, I need help figuring out how to take what I've done in the past and make it marketable as a future employee. We do partner with some places that will do job coaching, that will do, go with an individual into a job setting and will help them in their first few weeks or first few months get acclimated to that. Because the other thing that we've seen, especially with housing people who have been chronically homeless, so homeless for a long period of time and they have a disability, is that putting them into housing doesn't solve the problem. There's all of these underlying things, as Stacy hinted at. I can't even imagine that I wouldn't come away from experiencing homelessness without a behavioral health concern. Like if I didn't have one to start with, there's a lot of other things that I would probably experience that would give me, PTSD or depression, anxiety, all of these things. And those are crippling for some folks. And so what we find is that just providing the resource, if we just get them a job, no, actually it's more than that. It's helping them helping them get used to the routine, helping them with just basic skills that they may not have had to use for such a long period of time. And it's doing it with compassion, right? One other thing that we've been looking at a lot is hiring folks with lived experience or with different backgrounds and experiences, so that when we're serving people, we're not serving them from a level of us and them, more that we are serving them from obviously a level of compassion, but that people may on one side of the desk have experienced similar things to the other person on the other side of the desk or on the other side of the phone, as it were. And then finally, with our coordinated entry system, we do have the availability of some flex funds. we are able to provide that on a case-by-case basis. But kind of back to what Gary was saying and the quote that he was using, that homelessness is expensive, right? So you're using your resources every single day to stay safe and to stay healthy. And so how do you save for a deposit or first month's rent or, you know, all the other things that come along with it? So we do have some funds available for folks who are in need for that reason, or even just in need of support while they're trying to address their homelessness.
Thank you. Stacy, you want to dive in on that question? What services are out there to support the homeless population?
Sure. Although first, I just want to shout out to Holly for mentioning people with lived experience as being such a great resource as, you know, an employer to help engage individuals that we want to serve. We use a lot of peer counselors in our work, and I mean, nothing gives that provider credibility more than being able to say, "Oh yeah, I've been to that hospital," or "I've, you know, been homeless and I know what you're going through. I get it." It's just instant credibility. So I really appreciate you mentioning that. So, you know, one of the other things you said, Holly, was, you know, getting them housed is just the first step. And so, but it's like so critical, right? I'm a huge fan of the housing first model. We use that in our housing programs. It really kind of flips on its head the more traditional approach of, gosh, you know, get your behavioral health, you know, get your substance use under control, get your mental health condition under control, get whatever's going on for you under control, and then we'll find you a place to live. That is not a successful, useful approach. And so getting people housed first, and then get, you know, so they have that solid foundation to work from, and then bringing the services in around them. So permanent supported housing, to really say, okay, this is your home. It's not transitional, it's not temporary. You get to stay here, and we're going to work with you on a plan to help you be successful in your housing. And the rest, what are the rest of your life goals, right? Do we need to work on employment? Do you need health care? Do you need mental health care? You know, Housing First nationally has approximately an 80% success rate, which is, you know, significantly better than some of the older traditional models, which run right around 25 to 40% success. Success being housing retention, right? Being able to stay housed and be successful. So we were super fortunate recently to be able to open our new 82-bed permanent supported housing unit there behind our building on Broadway. And so this, I mean, it's 82 units. It doubles our housing capacity in Snohomish County, but it's still just a drop in the bucket in terms of what's needed, given, you know, the numbers that Holly mentioned earlier. But it's a start, right? If we can get folks in, then we can get the services to them so they can be successful. You know, our facility, as Holly mentioned too, right? We use coordinated entry for the bulk of our units, although we do have some set asides for veterans experiencing homelessness and for coming out of state psychiatric hospitals or local psychiatric units that are sort of transitioning out of the highest level of care. So I guess I just want to reiterate that the solution is to start with the housing and then build the supports and services around someone to help them be successful.
Thank you, Stacy. Dwayne, it's on you, sir.
Well, I would say as far as the models that we have available, they're not coordinated enough, and they're not funded well enough. I mean, and I hate to go straight to the funding all the time, but you know, the government systems and lists, wait lists and such, and everything that's out there, there's just not enough money. They need to be more accessible. They need to meet the people where they're at. And they need to be less siloed. And I'm saying this with the understanding that my organization is part of the problem too. I mean, we do housing, but we don't do other things. And so we're constantly referring people to all these different systems, and because it's not centrally done by a government agency, then it falls to a lot of nonprofits. So then you have a nonprofit for this, or a food bank here, or this, you have to go there. So we're literally sending people oftentimes on wild goose chases all over the county to get enough information or to sign up for different programs just to meet their basic needs. And that's to meet basic needs, you should be able to go to one place and get all the help you need. And that's my one critique, and that's what we need to do better to improve these systems.
I love that comment, Dwayne. Again, I'm going to be sharing little pieces here and there as we flow through this, but in 7th grade, my father and I were trying to get public assistance. So to go into Section 8 housing, we moved from DC to Maryland. Bethesda, Maryland had this assistance program. You had to go and check in with your kid, and then they would give you a voucher to stay in a hotel. And we stayed at the American Inn Hotel in Bethesda. So those of you who travel, if you ever go to Bethesda, you'll see that place. Looks like a nice environment, but there's all of these families who were chronically homeless that were surrounding that area. But that was stop 1. Stop 2 was on H Street, which is by Union Station in downtown DC. A hop, skip, and a jump from the White House and Congress is where I would have to sit in there, and they would evaluate me mentally, my family, before they give any assistance and services. So you jump around all of these spaces and travel by bus or however you could get there. And I think it puts a lot on people to try to experience that, and to go back then and still have that system of bouncing around. I think you make a seminal point, Dwayne, that having an all-in-one wraparound service is paramount. So in thinking of that, and obviously—
Hey, Gary.
Yes, go ahead.
Can I add one more thing to that?
Yeah, sure.
Because somebody mentioned in the chat about trauma-informed work.
Right.
And Stacy has mentioned that. And what you speak about and what Dwayne speaks about from a trauma lens, that is a change in the way that as a provider, we have to see people. Oftentimes we will get families or individuals who you find out are what we would call double dipping, right? Well, wouldn't you? Like, if you had to get on a bus at 8 o'clock in the morning with your child who's supposed to be in school anyway, and so there's an issue, right? And you have to go to all these places just to make sure that you can get your food benefits so you can feed your kid, or get your medical benefits so that if they get hurt, you're okay. If you could find a way to make all of that work for you as a person experiencing these things, I think from a trauma lens, you definitely would. I would. And so then we end up having a lot of issues on the service side. And this is a kind of an ingrained mentality for service providers that we're working on changing. But you kind of go from like, oh, why are you doing that? And you have to really change it to like, what happened to you, or what have you been through that has you in this situation? As opposed to that blame that comes along with like, I found out that you didn't tell me the whole truth about this. Well, you've had to tell your story 6 times to get $12 in food benefits or to get put on a list. Like, it's that trauma lens. And I'm sorry, I didn't mean to interrupt, but as Stacy brought up earlier, and as it come up in the chat, like really from a provider standpoint, looking at this in a different way is super important.
Yeah, I think this is very important to bring that to light, especially for our folks joining us on the chat today. I want to dig deeper here, because this is for Economic Alliance, Snohomish County. We've talked about holistic economic development, which means our 6 pillars, and merging those things together, knowing that if we are recruiting a company, that also means that we have to be focused on housing and workforce and talent and those things. Can each of you speak to how our business community can support these efforts, and also speak to how it impacts our business community to make sure that all of these services are working for our potential workforce that's out there? So let's start off with Dwayne, since you were the last, and we'll wrap around that way. So.
Sure. One of the things that I come back to is, during this pandemic, I think we've all been able to learn a little bit about, giving each other a little grace as we navigate these uncharted waters. And it's similar to, for a business person, for example, hiring somebody. Oftentimes people who are homeless, for example, don't have adequate transportation, and they might show up late for a job interview, for example. And it might be because the bus that's normally on time didn't show up this morning. And yet the person who's doing the interviewing thinks, oh, this person can't show up on time, what's wrong with him? And we oftentimes make generalizations, or we make judgments about people to sort of reassure ourselves that we're okay. And that's really something we have to stop doing, because it's really easy to make judgments about people, and nobody knows what everybody's situation is or what they've experienced. And I think if we could do that and provide each other a little more grace, because those are the kind of stigmatizations that injure people. I mean, not necessarily in a physical way, but it keeps them down and keeps them from moving ahead. And I think that's the one main thing. And obviously just the awareness, because we're talking, what we see on the streets is the very tip of the iceberg in the very worst cases. You see the people who are suffering severe mental illness or addiction or whatnot, or panhandling on the street. Those are the very severe cases. I mean, there are so many other cases of people who are experiencing homelessness and trauma, where they're perhaps, living. I had a call several years ago and I get calls all the time, and it drives me crazy because I can't do enough to help. But I got a call from a single mother who moved in with another woman she knew. They each had kids. The woman had one child, and she had 3 children, and they were all sleeping in the same bedroom with her. And the other mother had another child sleeping in the bedroom with her. It was a 2-bedroom apartment, and one was moving out, and she had 3 kids, and she doesn't know what she's going to do because now she can't afford the rent. And there's situations like that all over the county, and they're just all hidden from view. And I think that's what we really need to do, and support people that you can, if you can't hire somebody who's unemployed or needs the help. There's this idea that people don't want to work, and my experience is that's the furthest thing from the truth, is that people are more than willing to work, but they do need to earn a living wage in order to move their life forward too. So that's what I would say.
Thanks, Dwayne. Let's keep it moving, folks.
So I had a couple thoughts about this, and one of them is more to the mental health piece, which I always take an opportunity when I have a group of people to talk about mental health first aid. As employers, you have opportunities to encourage training for your staff, and mental health first aid is designed for the community to learn the basics of mental health, to recognize some signs and symptoms when you see it, which could help us prevent unemployment, for situations where we might be able to, provide some intervention and assist someone early on before things get to a difficult state for them. And it also just raises the overall empathy level in the community to understand and recognize and feel prepared to know how to successfully interact with, and of course, if you interact with the public in any way, you'll be interacting with individuals who have behavioral health conditions, which you may or may not know at the time, but having that skill set, just like most of us have probably taken first aid and CPR, that's a skill set that will come in handy in a variety of areas in your life. The other thing I was thinking about in terms of organizations and how they can help, the United States Interagency Council on Homelessness talks about solutions to homelessness, which are many and complex, but one of them has to do with building career pathways, right? So how do we create opportunities for people to advance, to gain the skills necessary? It kind of gets back to what Dwayne was talking about, these opportunities to develop a career. So working with folks who provide supported employment or other vocational programs to help people get back into work it's similar to Housing First, right? That's historically we have said to individuals, for example, with mental health conditions, oh, well, get stable first and then we'll worry about getting you a job.
Mhm.
The reverse is really true. People who work feel purpose, feel meaning, have a reason to get up in the morning. And if you are homeless as well, it is a pathway out, right, of homelessness to start to get that economic foundation that will lead to your ability to support yourself. So those are my two thoughts.
All right, Holly, you get to wrap up.
Yeah, I would kind of echo, I mean, obviously both Dwayne and Stacy kind of hit it all, but Dwayne talked a little bit about who you see on the street and that it's the tip of the iceberg. And I would completely agree with that. I think that a lot of times we hear homelessness and we think of that person that you see at the freeway interchange, or the worst case scenario that you can think of, and just recognizing that a lot of people who are experiencing homelessness are, like Stacy said, wanting to work, or Dwayne maybe said that, either one. They want to work, they want to get out of their situation, they want to do better. We see the same thing with families where there's a custody involvement. These families want to have their kids returned home, they want to have positive relationships, they want to set positive examples, and they are just facing so many challenges. So I do think giving people a chance, seeing people for who they are and not how they present, and just kind of challenging yourself to think outside of the box. That a lot of the hiring norms that we have, I'm gonna go this direction, I hope it's okay, really come from a place of white supremacy. And we know that poverty and homelessness disproportionately affect people of color, as well as people who are LGBTQ+. And so coming out of that, recognizing that when something bubbles up for you, that you're like, I'm not sure if this is the right candidate, like really checking that. Is that true? Or is that what I have ingrained in me because of the way that I have privilege? So I also think that's a big piece of it too, just finding a way to see people for who they are.
Thank you all. I think what I'll do is, just with the time we have remaining, make this a little bit more rapid fire, which means as I ask a question, I'll just anticipate that one of you will just take the lead on that question, and then we'll move to the next one. And so almost get in where you fit in here, so to speak. All right, so first things first, I think tied to what Holly mentioned, and Dwayne, you highlighted, and Stacy, you shortly highlighted on this as well. I just recall being a high school student, bumming change to get to school.
Mm-hmm.
And so you're hiding in plain sight for most of these things. You get to school and you're hiding the fact that maybe when you go home isn't really a home, it's someone else's place. Or how do I cover for where I'm staying tonight or there, or moving here or there, or finding a friend that'll let you stay here or there. But can you all speak to the impact on, as we talk about getting people back on their feet, tied to childcare? There seems to be a couple of comments in the comment section about the connection between the trauma pieces and homelessness, chronic homelessness, and childcare. Can you guys, who wants to take a stab at that?
We actually, I was kind of chatting with somebody in here. There are a couple of programs. So DSHS does have a Working Connections childcare program. So connecting people that way. There's a childcare subsidy, and it is based off of how many hours you're working. And as that changes, that can also increase. So that's a great resource. The other thing is our early learning programs. Snohomish County has a really robust early learning and childhood education program, and there's all throughout the county. There's small sites all throughout the county at most, at quite a few of our public schools, and they do early childhood education starting sometimes at 3, and those can be in in-home programs where somebody comes and talks to a family and connects them to resources, including childcare. But it can also be that the child goes to a facility or a drop spot. And they also work a lot with families on all of the other things that they need. And they recognize, they work with families who are experiencing any type of homelessness, as well as families who are housed or like housed in less than ideal situations. So they'll work with all kinds of people. So that's an option.
Thank you. Another question. Oh, go ahead, Dwayne. You want to chime in on this?
Well, childcare is important, and I'm not going to, there's no question about it. But one of the things that I've discovered over the years is that, for example, during the Bush administration, they came out with the work requirement. Everybody receiving federal benefits had to work. And the real secret here is that for a single mother with children, is cheaper for the government to just provide her housing subsidy and let her stay home and take care of her own children, rather than have her go out earning a middle wage job. Then they're supporting her for daycare, they're supporting her transportation, they're doing all this other stuff. And sometimes it's, whether we want to believe it or not, sometimes it's better to let that woman stay home, that mother stay home and take care of her own children and support her in that way too.
Okay. Another quick question for you all. There was a comment by, let's see, Steve asked, do we know what % of people experiencing homelessness in Snohomish County working are? So what's that percentage of those who are working, but also experiencing homelessness?
You know, I don't think we have the data for that, but one thing I will say is in 2019, the year before the pandemic hit, the average unemployment rate in Snohomish County was 2.8%. And yet we still had 56,000 families who paid more than 50% of their income in rent. So you have a lot of people working low wage jobs that just aren't covering their expenses. And so a lot of the people on our program sometimes not only work one job, but often work 2 low wage jobs.
Mm-hmm.
Okay. All right. Here's another question I have, and this was tied to, there were some comments earlier about this by Stacy, but just dig a little deeper. How does the behavioral health play a role in homelessness? Just a deeper dive if you want to answer that question.
Yeah, it is complex because I think, as we've talked about, the experience of homelessness often leads to the development of behavioral health conditions, whether that's, mental health disorders or substance use disorders, which especially difficult to treat during that period of homelessness. Not impossible, but really, extra challenging, just as everything becomes extra challenging when you don't have a safe place to lay your head at night, right? So, I think what we find in terms of actual, treatment availability for individuals in the community who are experiencing homelessness is that often we have to start with outreach, right? People are not just calling up, the access line and saying, hey, I think I'd like a mental health assessment, right? We have to go out and find them. And so those programs that do that initial engagement and that preliminary sort of outreach, because the other thing that happens for a lot of folks is it becomes really hard to trust some of the systems that are out there, right? That they have difficult experiences or they have, just lots of reason not to want to try yet again, right? We talked about all these multiple steps sometimes that people have to do to get a necessary service, and it could be exhausting. And so anything we can do to bring that to them, to engage, give the individual time to get to know us as providers and see us follow through and make sure that we really mean it when we're trying to offer, some true help. Those kinds of programs, I think, are what's necessary for individuals experiencing homelessness, because they're not just going to walk up to our clinic one day and ask to schedule an appointment most of the time. And unfortunately, most of those kinds of programs are not funded through traditional models, right? So what we're traditionally funded for is 1 hour of therapy. You come to my office, we have a conversation. And so we have to find some more creative ways of that pre-treatment engagement activity to get out into those communities where and even finding folks, like, as you know, I think Holly mentioned and Dwayne also talked about, that it's the less visible members of our communities who are experiencing homelessness in ways that are even harder to find, right? Harder to engage, that I think fall through the cracks if we don't make a real concerted effort about that.
Holly?
I would add on to what Stacy was saying, and I just wanted to kind of bring up, in case you weren't aware that this was out there, we do have in our county law enforcement embedded social workers, and they do a lot of some of what Stacy's talking about. They really are, they are accredited social workers who are partnered with law enforcement, not in the enforcement capacity. They're more in the engagement capacity. And so they are out in our communities. A lot of times they're looking for encampments, and they're working with people that they see in encampments, and they're building those relationships that Stacy talked about, where the first time they meet somebody, they may not have a whole lot of headway, but as they continue to check back in with that person over and over again, it's showing that person that they have somebody they can trust that's going to follow through. And then oftentimes it's on that third or fourth meeting that person will say, yeah, you know what, I think I'm ready to get my assessment. I think I'm ready to talk about getting into treatment, or accessing this service or that service. So throughout the whole county, we have from Arlington all the way down to Linwood Edmonds, we do have embedded social worker programs, and also east into Monroe. So if ever you guys needed any kind of connection to that, you could certainly call your non-emergency line. If you are seeing people in an encampment that you want somebody to kind of come out and check on them. But I am also happy to field any kind of questions that come up about how do I get in contact with somebody in my area.
Thank you. Thank you. There's another question that was tied to this, and there's one that just popped up, but I believe Susan Wong had a question about couch surfing, right? Those families that are going from place to place, are there programs that keep them from entering into the full on homeless space? But I would say that is as clear a level of homelessness as many others. But go ahead, Dwayne. It looks like
I think it's just a capacity issue. I mean, generally, our systems are overwhelmed, and there's not enough resources. I mean, those people deserve housing support or any other kind of social support, social service support. But the systems that we currently have, we're just overwhelmed with the numbers. I mean, and I think, and that's an awareness issue. People just have to be aware of the magnitude of the problem. I mean, in public schools in Snohomish County, 35% of the kids get free and reduced lunch. That means they're low income. That's over a third. It's a huge problem, but you look around and you don't see it because there's a stigma attached to it. So nobody's going to jump up and down and say, "Hey, I'm low income." That's not how it works. Or I'm homeless, or I have mental health challenges. Nobody does that because there's a stigma to it. And I think people just have to try to look past it and be aware.
Mm-hmm.
Thank you. There's another question here before we wrap up. I want to make sure that we at least touch on one final question. I think that this one will be a little bit tied to the connection between all of these elements. So talk about poverty and also drug abuse and addiction, and how that flows into maybe the residual results, right? Which is exasperated homelessness. And from my example, and this is a question I'll ask for each of you to just highlight your thoughts, but seeing the mental health component to parents as well. But my experience was similar to this, where if my mom and dad were deep into their addiction, I knew we were going to be evicted on a regular basis. Or if my dad was in prison, I knew that was going to create a strain on going to school or getting good grades, and the ripple effect for those things. How do all of those things play into the work that we have to do? And Dwayne, you mentioned there's no capacity for the space in Snohomish County. Speak to the lens of future assistance in that space.
Well, I mentioned once before, as far as, sort of revising our systems and meeting people where they're at, not making it so hard to get the benefits they need. Several years ago, I had a case where somebody on our program um, was basically working 16-hour days. As far as, by the time she was commuting to work, doing her job, commuting home, she was basically on the road and working about 18 hours a day, and just did not have the bandwidth to fill out her paperwork. And we can't keep you on the program if you don't do your paperwork. And she says, I know, but I just don't have the bandwidth. I'm just not going to do it.
Mhm, mhm,
And it was just, it wasn't that she didn't want to do it, and it certainly wasn't that she didn't need the assistance. She just did not have the bandwidth,
mhm.
and we need to figure out how to overcome that and meet people
Yeah.
where they're at, and get them help, even just filling out the application. Our Section 8 application has got to be a half-inch thick, and I don't think I could go through it and fill it out all correctly, honestly.
Thanks, Dwayne. Thanks. I'm going to cut that question short because I think you hit it pretty well, Dwayne. We do have one follow-up question. I'm going to ask that you use this, Holly, in your closing statements, and then I'll give you a little bit more room for time there. And then Stacy, if you would provide closing statements, and then Dwayne will come back to you. So Holly, the question from Catherine was, speaking of treatment for addiction, how many beds are available for uninsured and underinsured in Snohomish County?
Yeah, I actually just messaged Catherine and said I'll do some digging and I can get back in touch with her. But we do know that as with all of our services, we have more need than we have resources, which is just a super unfortunate truth. So I to speak to that specific question, I don't have an answer, and I wish I did. Stacy might have a better idea. I know she's working with behavioral health, so she might have a better idea there. Yeah.
Okay, so Holly, why don't you give us your closing remarks, and then we'll go to Stacy and then Dwayne.
Sure. I guess my big hope is that the takeaway from this is that we are working with people. We're working with an issue, yes, but we're working with people who are experiencing that issue, and that we really, as providers, as citizens, as business owners, it's a struggle sometimes to see people beyond the issue that's in front of you. But that's where I call myself all the time. Hey, this is somebody who's experiencing this, and that's where I would hope that we're all headed, is to see people not for what they are experiencing, but for who they are. And then just that we do have resources in our community. 211 is a fabulous way to find out about those resources. We do have also our Carnegie Resource Center in downtown Everett, and then Verdant Health in Linwood, where you can typically walk in and ask questions about resources. But somebody did mention too, like having that one-stop shop. So I would say, especially for families, keep bringing that up, because the more that people hear that that's a need, the more likely we're going to get that in our community. We have some family support centers in Arlington, in Granite Falls, and Lake Stevens, but sometimes it's hard to get to those places for folks. And certainly, as much work and as much great work as those centers do, we want to do more.
Thank you. Thank you so much, Holly. Go ahead, Stacy.
Yeah, thanks. I think, as just in closing, what I would say is, the causes of homelessness are complex and myriad, and the solutions are complex and myriad, but difficult is not impossible, right? And so, I have real faith in our community's ability to really effectively partner on solutions. I see it happening all the time in a ton of different ways. And I feel like that is one of the biggest, that's one of the biggest indicators of our ability to make progress in this issue, is the fact that different organizations, different agencies, different types of community entities can come together around a problem and each contribute their piece of the solution, because none of us is going to be able to have an impact just on our own.
Thank you, Stacy. I appreciate those words. Dwayne?
I would just say, again, stop yourself in your tracks if you start to find yourself being judgmental about your neighbors. You have no idea what they're experiencing. Support services that help. And basically, ask yourself, what kind of community do I want to live in? Do I want to live in a community that takes care of its neighbors, or do I want to live in a community that surrounds itself with a gate and doesn't let anybody else in?
Thank you. Thank you to our panelists, to Katie on our team for setting this up as well. I know this is not an easy discussion to have because we know that there is a lot more that needs to be done. Maybe we could talk to some of the millionaires flying to outer space about supporting these services. I think that might be a good use of funding as well. But to be honest, I think that anywhere that there are people, there is opportunity for power and for us to make a change. And I think one of the key closing remarks that I appreciate from Dwayne and Holly and Stacy is number one, meeting people where they are, realizing these are people that are going through this, and that potentially the person that you're working next to could potentially be having that same issue. A college student receiving a full scholarship, which was me. Going to college was actually stability, having a home for 4 years, so never assume that the person that's next to you isn't going through some struggle or hurdle that might be tied to this. We all need grace here. So I want to thank you all for providing some context to this important focus. We know that our elected officials are a place to start, as well as building those relationships and conversations. So let's continue to have those conversations in our communities. Dwayne, I appreciate your words, and Holly as well as Stacy. So with that being said, we actually have another coffee chats opportunity, July 27th, 8:30 a.m. Tools for New Abnormal. That's right, for the newer abnormal. So what we'd love for y'all to do is reach out to Stacy, Dwayne, Holly, if you have more questions, more comments, more thoughts. There's more to be had here. I want to thank you all for joining Economic Alliance in Snohomish County, another Coffee Chats with yours truly. Take care, folks. Thank you all.